Hi, Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Maragal Medical. Well, it's been 25 years that we've celebrated my chiropractic practice. This week, we're going to talk to you about why we came up with this team approach, the common conditions that we treat here at Maragal Medical, and the different treatment options that all patients have available to them. Not going to want to miss this one. Got some great information here, so stay tuned. Well, it's hard to believe. 25 years ago, I started my chiropractic practice with the vision of trying to help as many patients as possible without drugs or surgery. And I know when I met my wife, Colleen, as a physical therapist, we envisioned that maybe someday we'd have a combined practice with chiropractic and physical therapy. But as time went on, it became clearly evident that that missing piece of the puzzle was the medical care. And 5 years ago, you and I kind of joined forces together, and now we have all treatment options available where the medical care, the chiropractic treatment, and the physical therapy are all available to our patients. And that just makes them very exciting treatment options for our patients, right?
I agree, and congratulations for being around for so long, but more happy that we joined together and we actually got together to integrate this program, because I've always looked for that aspects of being able to extend services and really look at ways which we think outside the medical box, and we really put together different ways we can take care of people with musculoskeletal pains and really treat from a holistic program. Really makes people feel much better.
Yeah, as a chiropractor, certainly limited to some of the treatment options that I was able to recommend to patients too. And having you on board as our medical director, you have your established medical practice, Maragal Medical. I have my chiropractic practice, Gallagher Chiropractic PC, and with all of the different treatment options patients have, it's just a wonderful opportunity for them to seek out treatment options that weren't available before. And I know personally, I used to struggle as a chiropractor. I would get my acute lower back pain patient in the practice. We'd get them down on the table, but they were in so much pain, oftentimes it was very difficult for us to even do anything. Now, with your expertise, we're able to kind of, look at the patient as a whole. If needed, we can offer the patient some short-term course of medication so that we're able to do the things that we need to do.
And that's exactly what I think about when I came on, in the sense of, so I, in the standard medical practice, if you think about it, would see the patient, have the option to give them medications, get the diagnostic tests like we still do, but then it would just send them out, get them into physical therapy, wouldn't see them anymore. I know that this person could use a brace, know this person could use chiropractic, and I wouldn't see them. I'd write more prescriptions, we'll get them, I'll see them back, and how you doing? Well, I don't know who's really taking care of them. Now we can do the same medical model. I still see them, we still get the diagnostic test, we still see that the medical stuff is taken care of. I can prescribe medications, but it is short term. It's not goal to continue using it for the long term, because we have the chiropractic service right here. We can get physical therapy going. We can do all the things that we can do right at the beginning stage without having to piecemeal it later, and that limits the amount of needs for my writing prescriptions, and we get people back really much quicker than in general.
Right, and I think the most exciting aspect of having you on board and how we joined forces is just, in 2016, we saw FDA allowed birth tissue products to be used as an important treatment option for patients suffering with damage from arthritis or partial ligament or tendon tears. And that was a treatment option in the field of regenerative medicine that, just as a chiropractor, I wasn't able to offer solutions for our patients. And I'll add too, the other frustrating aspect of being a chiropractor is I used to see patients all the time that would come to see me with knee pain. Chiropractic treatment alone, I really had limited options on what we can do. And if we look at some of the more common conditions that we treat in the practice, those knee arthritic patients, gosh, they respond so great to those regenerative Wharton's jelly allograft injections.
Yeah, and as I was looking for those options, also not to write prescriptions only, thinking about other things that we can provide our patients, the regenerative injections also kind of sparked my interest to get people to treat all these musculoskeletal problems that I've taken care of. So now we're looking at the person from a holistic perspective, top to bottom. They come in for a shoulder pain, I'm still looking at their back, testing their knee strength, testing their body conditioning, because we want to get a person back functioning.
Right.
And so if we can provide treatment for all of their impairments and difficulties they're having by using these regenerative injections, by using our chiropractic service and getting them through, we can take care of all these issues right from the start.
Right, and folks, you know, we've been saying all along too, Medicare covers these injections now. Having the addition of physical therapy in the practice, we use this really cutting edge robotics technology called Hanova, all under one roof. If you'd like more information about our practice, please check us out on the web at maragalmedical.com. If you're suffering from joint pain, any area, particularly lower back, knee pain, shoulder pain, hip pain, you're definitely going to want to seek out treatment options at our practice. We take most insurances. Well, that's it for today. I hope you learned something. We'll see you again soon.
Bye now.